Thank you everybody and a very good morning. Today I am Ghulam Mohammad Raihan, acting as junior consultant of surgery and also resident of hepatobiliary pediatric surgery in Bangladeshl Sheikh Mujib Medical University, Bangladesh. Today I am going to present a case of giant choledochal cyst excision in a 75-day infant. Choledochal cyst is a rare congenital cystic dilatation of the biliary tract that occurred mainly in female but also in males, and male-female ratio is 1:4, and that is accidentally more prevalent in East Asian populations, and it is reported in per 1 lakh or 1.5 lakhs in Western countries, and the highest is seen in Japan, that is 1 in per 13,000. Though in Bangladesh we have scarcity of data, but we have some data, and from that we collected that it is 0.7% among the children admitted for liver diseases in Dhaka Shishu Hospital, and from another study we found that it is 3.5% of children with neonatal cholestasis admitted in Dhaka Shishu Hospital. So our case, baby Nasir, he was admitted on his 72nd day of birth with swelling of right side of the abdomen for last 1 month that was noticed by his mother, vomiting after which breastfeeding for last 7 days, and history of 1 episode of fever that was resolved 7 days back. When we examined him, we found that baby was allowed, non-anemic, non-icteric, and there is a palpable, mildly tender, globular lump occupying epigastric, umbilical, right hypochondria, and right lumbar region. The surface was smooth, soft to firm in consistency, and mobility could not be evaluated as the lump was mildly tender. So this is the pictorial of the baby, and you can clearly notice there is a visible lump on the right side of the abdomen, and this is the regions of the abdomen occupied by the lump. And accidentally, by contrast to other developed nations, his mother did not have any documented antenatal checkup or antenatal USG. In developed countries, choledochal cysts in such young age are usually diagnosed by prenatal ultrasonograms and treated accordingly. But accidentally, in this case, we didn't have any prenatal checkup or any prenatal ultrasound, and he was delivered by lower uterine cesarean section in local clinic due to prolonged labor. The ultrasonogram shows there is a large subhepatic cystic mass with dilatation of the confluence of the intrahepatic biliary tree, and that is suggestive of choledochal cyst. As I mentioned earlier, the patient was not icteric, but his alkaline phosphatase is raised, and so the prostomy time is 16 seconds. Other functions were normal. On CT scan, there is a large cystic mass occupying most of the abdomen, and by the blue arrow, you can see the mass is displacing the portal vein to medially, and also from the yellow arrow, you can see the intrahepatic biliary tree just above the confluence is also dilated and beaded. So from our picture, that was just simulated with type 4A choledochal cyst, and our diagnosis was choledochal cyst type 4A. So it is always challenging to treat a baby in such young age, but our plan of management was surgery, and we have done anesthetic consultation and also consulted with the pediatricians. And on a fine evening, we opened with a upper abdominal transverse incision and found this globular lump, and on aspiration, the bile was coming from the cyst, and the cyst was decompressed. And it was so large for dissection, so we have transected it and divided in proximal and distal sections, and you can see from the yellow arrow the demarcation between the terminal end and the duodenum, and we transected it at that level, and this is the proximal. You can see the gallbladder is collapsed. Possibly the gallbladder was non-functioning. The white arrow is showing the cyst, and the yellow arrow is the biliary tree opening. But we are not satisfied, so we dissected further up to the hilum level. You can see the right, we have dissected up to right and left hepatic duct confluence, and that is shown by the yellow arrows. And after dissection, the dissection margin is marked by the blue arrow, and the distal dissection margin is not seen because it is already behind the duodenum. And we had done a rho and Y hepaticojejunostomy and just below the confluence level. And this was the specimen showing the blue arrow is the gallbladder and proximal and distal resection margin is marked by the yellow arrows. But the postoperative period was not expected at the same, and the baby ultimately developed sepsis. And on the 5th postoperative day, his WBC count was 16,000 and also had electrolyte imbalance, that was hypokalemia. And that time injection vancomycin was added and treatment for electrolyte imbalance supplementation is given, and the baby eventually improved with time. And on 9th POD, the WBC count comes below to the normal level, that is 9,000, and the potassium level is going to the normal level, 3.8 millimole per liter, and we discharge the baby on 11th POD. Then we go to search for the literatures with the headline of choledochal cyst in PubMed, Google Scholar, and Hinari, and we found that youngest case in Asia was reported in Indonesia of 7 days, and youngest case of India was of 20 days, that was done in Maulana Azad Medical College, and both of the cases was diagnosed prenatally in antenatal checkups. And in Bangladesh, we found 3 studies, 3 case series. That first one is done by Zulfikar Rahman Khan sir and my teacher Mohsin Chaudhary sir. That is of 12 cases, and the youngest was of 12 years. Adnan Bacha from Chittagong and Arif Salam Khan sir, that are of 9 cases, and the youngest was 9 years. And from BSMME Pediatric Surgery Department, 32 case series, a series of 32 cases by Waliullah Khan sir and Ruhul Amin sir, that was youngest age of 1 year. So from our findings from the search, to the best of our knowledge, this is the youngest reported case in Bangladesh, and that is done by this team headed by my mentor, Dr. Ajil Abdul Hakim Shahin sir. But we are not satisfied yet, and we don't think we have come to the end of our journey or end of our course. There is no end to surgical innovations, and we are surgeons. This is only just our starting, and we will go further. Thank you.